Okay, this next chapter is going to talk about critical thinking and problem-solving strategies. So here's some tools for you for when you're in clinic or just in life to help you deal with situations in a more critical way and to look at things objectively and not take things personally. So as we look, maybe, there we go. So you have some objectives. You're going to define critical thinking and problem-solving skills. You're going to discuss the importance of critical thinking and problem-solving in radiology. And then you're going to describe the role of critical thinking in clinical, ethical, and technical decision makings and utilizing the steps involved in problem-solving. Also, apply teamwork and self-reflection in critical thinking, problem solving, analyze and determine appropriate actions for situations that require critical thinking, identify professional situations that use critical thinking and problem solving skills, and develop critical thinking and problem solving skills as a radiologic science professional. So, here's the thing. You have it or you don't. We can teach it to you, but the main issue is that you are able to stop from being emotional, stand back, take a look at the whole situation, and determine, okay, this is not personal, and I need to get through this in a calm manner. How am I going to do this? So here are some tools for you, okay? Critical thinking involves sound, professional judgment applied with high ethical standards and integrity. So your ethical standards are laid out by your RADT. They actually talk about the ethics that you need to uphold and the best possible standards for your patient. So that is all outlined in the RADT ethics. The nature of medical imaging inherently requires critical thinking skills. So you guys are doing it without even realizing it. Every time a patient comes in for any kind of exam, you have to look at the patient, determine what technique you're going to use, what size IR, how you're going to position that patient. So every time you get a patient, you're critically thinking. So don't underestimate it. You're doing it all the time. So critical thinking skills are traits that are employers expect. Yeah. We do. We expect you to be able to figure out how to get an AP shoulder on a patient that has been in a motor vehicle accident on a backboard that's laying obliquely on the backboard. So, or a dislocated shoulder where they're not moving and you have to be able to get your two 90-degree angles. How are you going to do that? And we expect you guys to be able to do that. And that's part of what critical thinking is. So, it's more than just simple recollection of knowledge of facts. It's learning activities that consist of problem solving, role playing, lab situations, case studies, situational judgment questions, and exams, and so on. So there's different ways that we can help you critically think without you even realizing that you're critical thinking. So we do it throughout the whole program without you even realizing that we're doing it. So critical thinking skills are taught at a higher level of learning and requires skills in analysis, application, evaluation, and content. So your positioning classes, this is exactly what we're doing. So we're teaching you what we need you to do. We need you to figure out how you're going to do it on the labs, and then you're going to be tested on it to make sure that you can actually analyze the situation, apply, and evaluate the image to ensure that you are getting what you need to get. So, problem solving and critical thinking steps. Identify and clarify the problem. First thing you need to do, figure out what the problem is. Perform an objective analysis of the problem. Develop a realistic situation to the problem. Consider all viable solutions to the problem. So the biggest thing there is keeping an open mind and listening to what other people might have to say and not just be set in your ways and say, no, this is how we're going to do it. So then you select the best situation or solution for the situation or the problem, and then you implement it. So critical thinking skills are taught in a variety of learning settings. So we do it in the classroom, we do it in the laboratory, and in the clinical environment. So professional standards support and define problem solving and critical thinking skills expected in the workplace. So we try to prepare you from being in the classroom, being in lab, and then sending you out to clinic that you will be able to critically think in a manner to be successful as a radiologic technologist. And critical thinking will require you to thoroughly understand your ethical responsibilities. So a lot of you will be shooting cross-table lateral hips. They're very hard to do. It's hard to get the proper angle, get the proper exposure, and we actually want you to understand if you have a diagnostic image, you don't keep repeating trying to get a perfect image. So you need to understand the ethics also so that you're not over radiating patients. Every patient experience is unique and requires adaptive measures in a wide variety of settings, so a complete understanding of the principles of this profession and its practice standards is essential. So it's important to learn to work cooperatively and in sync with physicians, physicists, nurses, and all allied health. So everyone in the hospital, you are all a team, and figuring out, okay, we have an barium enema, but we also have a CT scan and the patient's going for a colonoscopy. So you need to figure out and critically think which is the best pathway for the patient so that they can get through all the procedures the quickest. So steps, here we go. So you identify the problem and things that you can do in your book. There's table 4.1. It talks about, does a problem exist? What is the problem? What is the cause of the problem? And solving the problem is wholly responsibility. So you can investigate the problem, and you can do this objectively. So ask, what is known about the problem? What are all the aspects of the problem, and how will these factors influence the outcome? What are the key elements of the problem? Who or what or may be affected by this problem? What are the safety risks, liability, and implications? What are the technical considerations? And will more than one solution or type be needed? So really important to be able to ask those questions. So if you're stuck and you don't know what to do, start asking yourself questions. Okay, what's best for the patient? What can I do to make this outcome as positive as possible? So then you're going to develop viable solutions. What are your decisions regarding the problem objective and based on professional knowledge, ethics, and standards, or are they emotional? Be able to decipher between the two. How will these professional standards be applied and modified to fit the situation presented by the problem? Does any similar problem exist that have been successfully solved that can guide you to a possible solution? And will a creative solution be needed for this unique problem? So do you have to come up with something totally different, and thinking outside the box is what I call that, and try to figure out how you're going to get what you need to get and get it done quickly and safely. And then you're going to select the best solution and implement it. So which solution will allow the best care for the patient and is within professional ethical standards? And does the solution correspond with the procedures and protocol of your institution? So you got to make sure that you're within your parameters at your facility. And how quickly must the solution be enacted? And how does your solution affect the patient's outcome? So one thing here is that if you're doing what you think is best for the patient, most likely you're not going to get in trouble. You may get your hand slapped if you do something that's out of the norm, or maybe puts the facility at risk. If you're doing what's best for the patient, whether the outcome, usually you're going to be okay. So if you can justify what you're doing and really prove that what you're doing was best for that patient, then usually you're going to be okay. So there's 4 different case studies, and you're going to go under discussions and the discussion boards, and you're going to post a response on what you would do with each one of these. So in your book it talks about the different problem solving within it, so you'll want to go through and read that. And then I want you to sit back and I want you to answer what you think you would do. So here you received a request for a chest x-ray examination on a young female who is accompanied by her mom. As you begin to take the patient's history, you inquire about the possibility of pregnancy, and it is clear she's uncomfortable answering. So how are you going to handle that? I've had this situation more times than I can count, and a few times the patient was pregnant, so and all the way down to 9 years old. So don't be fooled. A lot of the times when it's that young, it's usually rape, but they're sexually active usually at over 10, which is really crazy. But don't be shy in asking, but yet you got to be careful in how you do it. I'm not going to tell you how I do it because I want to hear how you do it, how you think the best way to do that is. And your case study number 2, you're a technologist working third shift alone in a small community hospital. You've received a phone call from local police department regarding modal MBA on a patient you radiographed earlier. The person calling is the officer who is in charge of the investigation. In the process of completing his paperwork, the officer has asked you to provide him with the results of radiographic examination. He is insistent and indicates that he has done this many times before at your hospital as well as other hospitals across town. How are you going to handle that? Are you allowed to release patient information? It's an officer and he's demanding that you tell him. So what are you going to do? How are you going to handle this? Case 3, you work as a mammographer in a small community hospital after the morning activities have been completed, and while you're at lunch with all your coworkers, you overhear a conversation between 2 hospital staff members regarding a mammography patient you saw earlier that morning. The conversation of the staff members is not subtle, and you are certain almost everyone in the immediate area heard some portion of the conversation. You are also aware that the information you overheard is clearly inaccurate. How are you going to handle that? So even if you're good friends with these people that are talking poorly about this patient or saying things that aren't true about the patient and other people can hear, what are you going to do? How are you going to handle it? I've had this so many times. It happens. It does. It happens. People talk. Some good juicy story on a trauma case. It's like, oh my gosh, you know, and you're talking about it and it's on the news and they say who it is, or they say that there's an accident and you're like, oh my gosh, that was my patient, that's so and so. You can't do that. So tell me how you'd handle this situation. And in your case study 4, you're working with one of your team members to complete a digital portable chest. The portable x-ray machine displays the patient information on the screen as part of its operation. Following the completion of the portable exam, the unit is parked in the hospital ER corridor, so it's in the hallway, and left there as your coworker hurries off to lunch. What should you do before joining her or him for lunch? So what's going on with that portable? Is it okay that they did that? Who should you talk to about that? And you know, as you know, I want you to refer back to HIPAA, and I want you to talk about HIPAA a little bit with that. So be sure to answer that question. So in conclusion, clinical thinking skills are vital. Learning occurs at 3 levels, so you need to know those. General knowledge, it deals with your general knowledge, attitudes, and values, and your psychomotor skills. So critical analysis is a 4-step process, and good critical thinking and problem-solving skills are marks of professional imaging technologists and often involve team thinking. So we work as a whole, and you have to do what's best, not just for you at that moment because you want to go lunch, but what's best for that patient, what's best for the team caring for that patient. Okay, so those are your tools in critical thinking and problem solving. I hope they help, and then you have your 4 cases in your discussion board for you to respond to. Have a great weekend.